The Bronx Knows partners. So who were they? Partners included colleges and universities, community-based organizations, community health centers, correctional facilities, health departments, TB and STD clinics, faith-based organizations, hospitals. And as I described earlier, partners from across these sectors were engaged early in the planning process and played a key role in gaining institutional and community support. By the end of the initiative, we had more than 78 partners representing over 140 testing sites. In conjunction with Bronx area providers, the health department developed numerous marketing products to inform community members of testing facilities and to encourage testing as a primary form of HIV prevention. Social marketing strategies included radio PSAs, radio-sponsored testing events, print materials such as billboards and station domination in subways. That's where the only poster you see in the subway station had to do with our HIV testing. And also they were in English and Spanish. And in this slide, you can see a couple of the sites, in addition to the subways, is a hair salon. So I'm proud to say that along with our partners, we observed three very important changes in the Bronx during the life of the initiative. Marked increase in testing, which we had been able to measure not only through testing and linkage to care data reported by initiative partners, but also through data reported from our 2009 Community Health Survey. When we look at the map on this slide, which shows the percent of New Yorkers ever tested for HIV by neighborhood, we see that the Bronx is highlighted in the darkest colors, which represents rates of testing. And it shows far more testing rates than any other borough. Through the Bronx Knows, 607,507 HIV tests were conducted. 4,820 of those tests were confirmed positive, which identified 1,731 new cases of HIV. By the end of the initiative, the Bronx Knows partners as a group had experienced an increase of almost 50% in HIV testing from baseline. Secondly, consistently high linkage to care rates, which I'll address in the next slide. And thirdly, a network of collaboration of 78 community partners worked together to raise HIV awareness. In terms of partner collaboration, here are just a few important highlights of significant shifts in the landscape that took place during the initiative. Increased testing in non-traditional venues, such as places of worship, college campuses, pharmacies, dental settings, and local businesses, such as hair and nail salons, was made possible by our dedicated and committed Bronx Knows partners. Numerous high-profile testing events for all major HIV/AIDS awareness days. The Bronx Knows helped to coordinate education and testing efforts at least monthly at many non-HIV-related events, such as faith-based gatherings, business expos, health and job fairs, youth mobilization events, LGBT Pride. We also had great events at the beach, nightclubs, art museums, and one final fantastic hip-hop concert. So as you can see from this slide, linkage to care rates increased more among the Bronx Knows partner agencies than residents in other boroughs. Lessons learned. What we learned from this approach is that a coordinated routine HIV screening initiative in healthcare settings paired with increased targeted testing in the community can effectively improve HIV case finding and linkage to care on a municipal scale. We believe the keys to our initial success were taking a multi-sector approach to increase HIV testing throughout the borough, and the strong collaboration between the health department and our community partners. Our key lessons learned include allowing ample time for the planning process. Invest more time into the planning process than you think you'll actually need. Get early buy-in from key stakeholders. Make your list inclusive, and think outside of the box. Some of the biggest advocates of what went on were non-traditional HIV care from not the care provider world. Address challenges of HIV billing and reimbursement. Ask your partners, what type of technical assistance would be most beneficial to you? Provide ongoing TA to partner agencies. The department has to have adequate staffing, and start planning for sustainability early in the process. Both you and your partners need to plan beyond the initiative. What is your end goal? Do you want to make institutional changes or just increase HIV testing for a finite time? So what happened to the Bronx Knows after June 2011? I'm very happy to say the Bronx Knows does indeed live on as an HIV testing network led by community partners with some health department assistance. It continues to encourage collaboration among partner agencies and other Bronx organizations. It continues to maximize routine HIV screening in clinical settings and target case finding in non-clinical settings, and to share best practices to enhance prompt linkage to care and support services. I would like to acknowledge my colleagues who were responsible in helping me put together this presentation. For more information, you can log on to our Facebook page. You can also find a full report of this 3-year initiative at www.nyc.gov/BronxHIV testing.